Mm. I would like to greet everyone. Today we are already Sunday, the 17th, 2022. My name is Yanick Dantiste. I am a family nurse practitioner based in West Palm, Florida. Um, Before we start, I'm going to tell you a little bit why I think that I have the authority to discuss, to have topic about health promotion and disease prevention. By trade, I am a nurse, a registered nurse, a registered nurse to begin with. I've been working as a nurse for more than 30 years. I started in Canada, then I came here in Florida, and then in 2001, I got my master degree in nurse practitioner, um, family nurse practitioner at Berry University. So I've been working with people of all lifespan, but most likely for most of my profession time, I've been working with elderly people. Like, in Florida, we have a lot of elderly people. So since 2002, I've been working as a nurse practitioner at the VA West Palm Beach, and mostly it's elderly, mostly they're 65 and up. Um, Veteran population, there are subpopulation that um, whatever disease or illnesses we found in that subpopulation, we found it also. We can find those same issues to general publics. So what I'm saying is that when we see like hypertension, hyperlipidemia, diabetic, heart problems, high cholesterol, we see like GERD, acid reflux. This is same diseases we can find also in the general population. But we have different, um, the veteran population has um, how do I put that? They have uh, different disease who really characterize them, such as PTSD, um, you know, most likely like some mental issues. They have, it's really special, especially we can find those diseases in that population, but all the diseases is the same one we found. So that's why according to what I've been seeing, according to what I've been treating, I think it's good. I'm starting to educate the general population about that, different diseases, illnesses, the sign and symptom. So tonight, what we are going to tackle tonight is what are the disorders of the mind and emotions. Okay, so before we start um, talking about it, so what we are going to do, I'm going to um, enumerate different illnesses we can find in that. This is the topic, the disorder of the mind and and emotions. So before we start, I would like to always start with inspirational quote or thoughts. So I think that will help us to lift up us, because sometimes we think, sometimes uh, our thinking or what go on this world. Sometimes we can feel sad, but sometimes if we read some inspirational quote or thought that will help us to remember, okay, what to do or not to do. So for tonight, our uh, inspirational thoughts will be, uh, quote, don't be afraid to walk away from things, places, and people that leave your heart, your soul, or your heart heavy. So I'm going to repeat it again and listen to it carefully, because that's that can help us to reduce anxiety, help us to reduce stress, and help us to sleep better at night. So the quote is, okay, the inspirational quote for tonight is, don't be afraid to walk away from things. Things mean, can be anything. Like, let's say you have a car that you cannot pay, right? You have difficulty to pay, or you have a house you have difficulty to pay. So don't be afraid to walk away from those things. Places and people, okay? People can be anything. Can be your children, can be your husband, your wife, your friends, can be anything. So don't be afraid to walk away from things, places, and people that leave your heart or your soul heavy. So by doing that, okay, you will you will you will you will put yourself at peace. Your mind will be at peace, your heart won't be heavy, and you can have a, decent life. So having said that, so let's tackle the topics for tonight, which is the disorder. What are the disorder of the mind and emotions? Um, so the disorder of the mind and emotions. You know what? Let's write them. When we write them, we can remember them much better. Okay. The disorder of I erase. Okay. Disorders of mind and emotions. So what are they? First of all, addiction. Addiction is one of the disorder of mind and emotions. So addiction is one. The second one is obsession and compulsion. Obsession, how to obsession and compulsion. Okay, the third category of disorder, who is include, who goes with the disorder of the mind and emotion, is phobias. Phobias or fears, the same thing. Phobias or fear. This is, and the fourth one, depressions. Depression goes also to that category. The next disorder will be stress. The next one is anxiety. Okay, all included in the disorders of mind and emotion. And the next disorder will be insecurity. So, insecurity. So people who doesn't feel secure, they feel like they're imbalanced, they're not secure. So insecurity. So this is another disorder of the mind and emotions. The next one will be uh, memory loss. People who lost their memories can fall into that category as well. Disorders of mind and emotion. So, memory loss, that's one of them. And last one but not least, insomnia. Insomnia is difficulty to fall asleep or difficulty to sleep. Okay, insomnia. So, okay, so I mean, they are more than that, but the most important ones into that category, that's what they are. So, the disorder of mind and emotions or what? Addictions. Okay, that's falling into that category. Obsession and compulsions, phobias, which is fear of something. People can fear of height, fear of spiders, fear of crowd. Is all, we call those all phobias. So this is, it's uh, uh, illnesses from their minds and emotions. Depressions is one of them. Stress, anxiety, insecurity, memory loss, and the last one is insomnia. Okay, so now let's talk about their sign and symptom. Okay, so we are going to take each of them, and we are going to discuss about the sign and symptom. So the reason I want to do that is if you or your loved one or your friends have those symptoms, you can recognize them. We can you can recognize those symptoms, and you can know exactly, okay, that fall into which illnesses, which category, and to seek help, because you can find some help. So if you find somebody, or if you know someone who have those symptoms that we are going to discuss about, what they can do, who can help them, they can talk, talk with their primary care provider, which can be a doctor, nurse practitioner, or physician assistant, which one they have, and also psychologist. Okay, um, so the providers can be the PCPs, which is primary care provider, or psychologist. Okay, so those provider will help them. You know, we help them by helping them really go into detail, go deep to see why they have those symptoms and what they can do to really remove from their life. What how the they will help they will help them by give them um some, what you call, some they will help them by helping them, giving them some coping skill. If you have that situation, how can you cope? So that's why you need guidance. Sometimes the third party is much better because they are neutral. uh, when you're neutral, they're not your family member, they are not your friend, they're here really to help you, and they'll see you in different perspective, right? So that's why it's always good to seek help. Don't wait, it's too late, or you become so depressed that you want to kill yourself. No, there's help. There's help. There's help. I will never stop saying that, because as it is now, the rate of suicidal, as we know, is very high. Okay, young one, old one. So if you see something is wrong, there's symptom, there's sign you didn't have before, still help. Ask, talk to your provider, or go see a psychologist. The psychologists, they are here to listen to you, to really go deep into details, to explain to you why you feel this way, and they will help you with coping skill, and they will do something called psycho therapy, so you can feel much better. So the worst thing is have those symptoms and you don't do nothing. There is help, but you need to go and find those help. You need to go and seek those help. Those help won't come to you. Okay, so let's talk about the sinus symptom for addictions. Um, Everybody, I mean, again, what is addictions? Okay, an addiction is an overwhelming craving for or dependence or dependence on a substance. Okay, that substance can be alcohol, nicotine, uh, um, illicit drugs, can be sex. Okay, so the addiction can be um, different type of addictions. But the topic of today is really to help you recognize the sinus or symptom. You know, sinus symptom is that, how you can distinguish, how you can recognize when somebody have those um, diseases. Okay, so let's start for addiction. Addiction, the symptom of addiction can be loss of control, overuse of the drug or the substances. Some people can drink, they can drink, for example, some people can drink alcohol. So they know when to stop, right? They know when to stop. They are going to drink. Sometimes they drink one glass a day, or socially they can drink, when they have guests, they drink, and that's it. But some people, they don't know how to stop. They don't know. So they drink until they become impaired, until they have slurred speech, they cannot talk. Um, so those people that they don't have no boundaries. Okay, and also the scientific also research shows that there is some trait of personality which can lead to addiction faster than others. That's another topic. And also the symptom can be mood swings or and irrational behaviors in drug addiction. So that people who has addiction, they have mood swing. So that's meaning they can be nice, and the next thing they snap. Okay, they can be very malice, very arrogant, and they want to fight. So their mood of swinging. So they are not the same. And also symptom can be sore or red eye with dilated or constructed pupils. So in their eyes, in their pupil, they will be constructed and dilated. Usually, you need to assess that pupils with the light, that will help you to see it most of the time. And one of the symptoms also for with addiction is irregular heart breathing. So their breathing is not even. Okay, it's uneven. So that caused by the substance they are taking. And also their hands are trembling, shaking. So like nervousness, they are shaking, their hands is shaking. It can be sign of addiction as well. So if you have your loved one, or you who you are drinking alcohol, or or you smoking, or you are doing some illicit drugs, which is cocaine, marijuana, heroin, meth, and you found out that your hands are shaking, or your loved one, their hands are shaking. So think about addiction. And itchy or running nose, especially people who's taking coke, they are using their nose, you're taking that. So if your nose, you have running and itchy nose, can be that. Okay, that's for addiction. And the next one is obsession. What is the sign of symptom of obsessions and compulsions? So what is a obsession and compulsion? Obsession is compulsion is a behavior that the person repeats it all the time. So they said an obsession is a persistent, recurrent thought or idea. Okay, while a compulsion is an overwhelming drive to perform a particular act, like somebody can be. Sorry, I have to take something. Something fell. Okay. So somebody can be compulsion, like they are super clean. Okay, they feel they find themselves cleaning nonstop. Okay, you are compulsive. So what is the sign of symptom for someone who have that disease, who have that obsession, compulsions behavior? So first of all, fear of contaminations. Okay, so if you see someone, they always have spray, they're spraying, they're cleaning. Somebody just sit on the chair and they're spraying. Um, think about that. Obsession, compulsion. It's good to be clean, but sometimes people they overdo it. That's when the obsession, compulsion come in. Dermatitis caused by repeated washing. So their people hands can have some rash. We call it dermatitis, inflammation of the skin tissue is because they wash their hands too much. So they are compulsive by cleaning their hands, by washing their hands too much. So they have that skin disease. And the other one, they might have possible of depression because when your thoughts, your thought is working on, it has the repetitive thoughts about the same thing over again, you will end up possible with depressions. Aggressive thoughts and behaviors. This can be another sign of symptom of compulsion and obsessions. Um, inefficiency caused by repeated and meticulous checking. So they all fall into that. Okay, so you checking, it's the behavior is repetitive and meticulous. So that's when you will discover that someone or you can be obsessive compulsive. And also there's different degrees. Okay, some people can be more obsessive compulsive than the other. I personally think I have that trait, just a little bit, not too much, because I like my place to be clean. I like my stuff to, a certain ways, because if like if I come home, I know when someone touch my stuff. I know, because the way I put it, and I come, I said, you know what, somebody came and touched my stuff. So I think I personally have some degree of it, of obsession and compulsion, but some people they go really into extreme. So that's when it's really become a disease. Um, Next one is phobias. So what is phobias? Phobias is fear of stuff. Can be anything. Fears of um, elevator. Some people they cannot take uh, elevators to go, to go like this, the floor, like fifth floor or 10th floor or higher than that. They are fear of snakes. They don't like, some people, even though you talk to them about snakes, they can pass away, pass pass out, they were really fear of snakes or spiders. Somebody, they see spiders, they are going to fall. They are going to lose their conscious. Some people, they have fears of driving. They don't want they cannot drive. They just have that fear. So all those fear come into that category of phobias. So, what is the sign symptom? It's rapid pulse. People who have phobias, who have fears, their pulse, their pulsation. If you check their pulsation is very fast. Their heartbeat is racing. Also, they have profuse sweating. If you touch their hands or their feet, they are sweating. Because that fear. And their blood pressure can be high. If you check their blood pressure, they have a high blood pressure. So that's what that caused by the phobias. They are trembling, so they can shaking. Their hand, their legs, they can trembling, and also they can have nausea and vomiting. So their phobias can affect their gut, their GI. So now they end up with GI symptoms such as nausea or vomiting. So this is sign of symptom of when somebody have excessive fear. So when you have excessive fear, that's when we call phobias, and that's when you can have all those symptoms. So the other one is depressions. Okay, so depression can be caused by many things. So that's why before I started tonight, I said, I like that inspirational thoughts, which said, don't be afraid to walk away from things, places, and people that leave your soul or your heart heavy. So because if you don't do that, okay, if you don't walk away from those things who hurt you, you can fall into depression. So that's why I love that inspirational thoughts tonight. So stress. What is a sign of symptom of stress? Increased breathing and heart rate, nausea, again the GI. So when you have stress, that affect your GI health as well. Tense muscle, so you feel your muscle is tense, like your neck, the back of your neck, you can feel it, it's very tense. Or your forehead, you can feel that. So in long-term depression, sorry, not depression, long-term stress, long-term stress can lead to what? It can lead to different things too. Okay, short short-term stress. You can have difficulty to breathe. You can have increased breathing and heart rate, nausea, and your muscle. The neck muscles, maybe your forehead. They can be tense. But if you have depression, long-term depression, okay, so let's say long-term, 6 months and more, that can lead to insomnia. So that's meaning you're going to have difficulty to sleep. That can lead to depression. That can lead to high blood pressure. You see the high blood pressure, it come up all the time. So so many things affect your blood pressure. So that's why we need to live a life that um, reduce stress. Whatever going to cause us stress, walk away from it. I know it's not easy, but sometimes you need to do that because it's your life, and your health. Also, you can have hair loss. Um, I I met few people. They are losing their hair, but they don't know why they are losing their hair. They go to the doctors. The doctor cannot find nothing. Sometimes it's just simple that they are under too much stress. Can cause by anything, their children, their husband, their wife. anything, their workplace, and they are losing their hair for they don't know why, and sometimes it's just simple than that. Allergies, some stress can cause you having those allergy symptoms. Ulcers, ulcers is a big one. um, you can have ulcers, and people said, "Oh, I don't know why I have ulcers." Yeah, it could be. It can be caused by acid. If you have too much acids in your stomach, can cause that. But stress can lead to that as well. Okay, heart disease. It can, sign or symptom. Heart disease can be one of the symptoms of stress. Digestive disorders, can be like acid reflux, um, menstrual problems, um, people who in childbearing age. Sometimes you can hear them saying that, what, I didn't see my menstruation this month, or I have my menstruation every 2 or 3 months. That can be a sign of stress. They have a lot of stress, so their menstruation is skipped. Is not regular the way it's supposed to be every month. Palpitation, so their heart beats fast. They have uh, a palpitation, so can be one of the sign of stress. And also for men, impotence and premature ejaculation. So that can stress can cause that. So it's very important to really, as much as you can, to reduce your stress, because stress can lead to so many uh, symptoms, and those symptoms at the end then can cause diseases. Okay, so next one, anxiety. So what is a sign and symptom of anxiety? Okay, it's good to recognize that, so we can sometimes we can think, or if I have that symptom, sometimes people can think, it's medications, something else, but sometimes it's simply, anxiety. That's why you have that. Try to see, why you are anxious about, and try to see if you can work on it, decrease it, seek for help. um, One of the signs and symptoms for anxiety is dry mouth. Your mouth is dry, the mucosa, everything is dry. Sweaty palms also come back. When you're anxious, you have anxiety, your palms, your hands, you're sweaty, you're wet, you're clammy. They can be cold as well. So you have rapid pulse or palpitation. So you have your pulse is fast, and you have palpitations. So your heart beat fast. In anxiety neurosis, we call it anxiety neurosis. You can find the following symptom: breathlessness, so you cannot breathe, or your breathing is so shallow. That's how they call it. Headache. Okay, you have generalized weakness and fatigue. So can anxiety can cause that feeling of tightness in the chest. So if you feel like your chest is tightening, could be a sign of anxiety. High blood pressure, come back again. If you have anxiety, that can cause your blood pressure to go high. Okay, so now we can see why people, stroke is very high, very, high in the society, because almost everything, the disorder of the mind, of emotion I mentioned, each of them can cause your blood pressure to be high. Abdominal pain. Okay, if you have anxiety, you can have abdominal pain, so your belly can hurt you. And diarrhea, you can have that also. Anxiety that can cause that. Some people, they can have diarrhea because they are too anxious. Insomnia, So anxiety can lead to difficulty to sleep. You have difficulty to sleep and loss of appetite. So when you're anxious, some people they don't have no appetite. They cannot eat. So this is the sign of symptom you need to recognize, and once you recognize them, seek for help. So how are you going to seek for help? Talk to your a primary care provider, or if you have insurance and you can go directly to a psychologist. And I think psychologists, they are very good. They will take their time to listen to you, to go deep into the root of the problems, into why you are, why you're feeling like that. And sometimes when they bring when they go deep into the problem, you know stuff surface, and then you realize, okay, I have to change this way, and they teach you some coping skill, very very im- im- important. If you know coping skill, how to cope in certain situation, that will reduce your stress, your anxiety significantly. So that's why it's good to seek for help. um, when you discover the silent symptom, don't wait before it's too late. When I said don't wait before it's too late, those kind of symptom, if we wait too late, that can lead to all the diseases, which now we have to go to the doctor, we have to get medication. Let's say, all those disorders here, as we can see, they can cause high blood pressure, right? If you have a lot of if you have high blood pressure, as we know, high blood pressure can affect your eyes, it can affect your artery. High blood pressure, it can affect your kidneys. So if we don't seek help, and all that blood pressure, that can mess up your body, and then after that you end up taking medication for high blood pressure. So it's good when we know those signs and symptoms, we seek for help. So there's a lot of things we can prevent. Okay, that's where that's where health promotion is come up handy. You try to promote, and you prevent diseases by recognize the sign of symptom, and by seeking help as soon as you can. So the next disorder of the mind and emotion will be insecurity. Okay, so what is insecurity to begin with? Um, like the name tell you, when people is insecure, is is a feeling that affect everybody at one time or another. It can be triggered by physical, social, financial, or emotional factors. Okay, all those factors can trigger that feeling of insecurity. Let's say if you don't have too much money, right? You can feel insecure that you're going to pay your bill. Okay, all those things that can trigger that feeling. So, and that can often induce anxiety, and it's also, and those symptoms. So, what are those symptoms of what are those symptoms of insecurity? The symptom of insecurity can be dry mouth. You see again the dry mouth come back. Sweaty palms, you come back again. Rapid pulse and palpitation. So your pulse is fast and your heart beats so fast. So that's when your insecurity can cause all the symptoms. And although the symptom, same thing with anxiety, neurosis, like breathlessness, your breathing is kind of shallow, or you don't breathe at all sometimes. And you can have headache, generalized weakness, fatigue. You can have um, feeling of tightness in the chest. That is the same symptom you find in anxiety, you find it also in insecurity, because when you feel insecure, that will lead automatically to anxiety. So that's why you will find the same symptom in anxiety, in insecurity, same thing. And again, we have to remember this is the disorder of the mind, of emotion. So they come back. All those symptoms, they come back. Um, high blood pressure. So insecurity can lead to high blood pressure, abdominal pain, diarrhea, insomnia, and loss of appetite. Same thing with anxiety. So we can see the similarity between anxiety and insecurity, because when you're insecure, that insecurity for whatever reason you are insecure, that will lead to anxiety automatically. So that's why the symptom is there. That's why you really need to find a way to decrease those insecurity, to help you, find some help, seek some help, so that will prevent the symptom to lead to a disease. Um, that's what's for insecurity. So memory loss. Okay. This is another um, problems fall into that category: disorder of mind and emotions. So what is memory loss? We can have a total or partial loss of memory, and also we can call that amnesia. Okay, so the memory loss we can call it amnesia. Is the same word, for memory lost. Um, so what is it? Okay, so we can memory loss can be physical or mental. So mental, like the dementia type, if like Alzheimer's, Alzheimer can cause that. Or physical, let's say somebody has a blunt, has fall, and they injure their head. So that can lead to a memory loss. So the amnesia, which is the same thing then memory loss, can cause by physical and mental. So uh, what are the sign and symptom of uh, memory loss? Um, the sign and symptom, there's not really sign and symptom. It's just that you see that person, they lost their memories. They cannot remember stuff. They cannot remember where they live. They cannot remember, not even sometimes they don't remember their name. Okay, and somebody, you can see that person, they are losing, which can be severe, or that can be mild. Um, Often amnesia, which is the same meaning for memory loss, can be very often be a complication of alcoholism. So people who drinking a lot of alcohol, okay, alcoholism can lead to memory loss. So we see that people who drink a lot, their memories, they are not as sharp as they used to be. Also, depression. When you have depression, that can lead to memory loss. Next one, anxiety can do that too. Stress can cause that. Poor nutrition, inadequate sleep, or lack of stimulation. So that's why in elderly population, it's important to do activities with them, because if you don't do activities, like crossword, you don't talk to them about um, what's happening, in the world. You don't tell them the news. They're going to lose the memory. So you need to, they need to have stimulations, one way or the other. Let them watching TV, listening to the music, or whatever they can do. If they can play piano, let them play piano if there's a piano there. So they need stimulation, because without stimulations, you're going to lose your memory. By the way, there is a saying. state. There's a saying, which which state that if you don't lose it, you will. If you don't use it, you will lose it. So that's where that come from. Um, so that's why when you have those kind of symptoms, you need to, or those kind of disorders, you need to get treated as soon as you can, because that will lead. Because we remember, we are talking, you see, we talk about the depression, we talk about the stress, okay, and you see all those things, they can lead to memory loss. That's why it's so important to seek help when we have those problems. Okay, that's why we need to know the symptoms, the silent symptom, and to seek help. So the memory, again, I'm going to repeat that. I think is very important. The memory loss, okay, that can be often be a complication. So the amnesia, the memory loss, it can be a complication of alcoholism, people who drink too much alcohol, depression, anxiety, stress, poor nutrition, inadequate sleep. People don't sleep enough. You need to, everybody is different. Some people need 5 hours, some people need 8 hours, some people need 10 hours. So whatever is, well, but in general, they said everybody should have 8 hours of sleep per night. So this is the recommendations. Hours people need to sleep in order, when you wake up in the morning, you can feel rejuvenated. You can feel fresh again. So yeah, and the next one, not least, insomnia. Okay, insomnia is what is insomnia? Is insomnia is someone who has difficulty to sleep. Okay, so what is a side of symptom? What is the sign to find to someone, so you can recognize that person, that individual has insomnia? That person can have an overactive mind. Okay, the mind is overactive, so it's racing, it's thinking all the time, causing difficulty in falling asleep. So that's why they always encourage sleep hygiene. Sleep hygiene means, before you go to bed, try to uh, keep your room dark. Don't, if you like to read, try not to read. In your bed, try to have your room set it up for a good night's sleep. Okay, the music, no music, so you can fall asleep. um, Nervousness can be one of some symptom for insomnia. If somebody is nervous, is too nervous, you won't be able to fall asleep. Restlessness, you don't feel at rest. You're restless for some reason. Nightmare, once asleep, that person, kept if somebody keeps having nightmares, they won't be able to sleep, because the nightmare will wake them up. That's for sure. And irritability, mood swings, involving historical behavior. Somebody, they are labile. Their mood is very labile, which means their mood can change, drastically. Somebody can be calm, and the next thing you said, "Whoa," it's like night and days. Very, fighting mood. Be aggressive and everything. A fear of bedtime may eventually develop. So when people have insomnia, so now they end up, the bedtime, they end up not like, they don't like, they have a fear for bedtime, because they know that they're not going to sleep. All right. So In any disorders, okay, it doesn't have to be disorders of the mind, of emotion. They have disorders of nervous system, disorder of respiratory system, cardiac, muscular. In every disorder group, we need to recognize this kind of symptoms. So by recognizing this kind of symptom, therefore we will know when and where to seek help. That's what my role will be. Okay, my role will help you to discover different uh, uh, category of diseases in each disorders and their signs and symptoms. And sometimes we will come with this treatment also. You know what kind of treatment they we do also. But most likely, I will like um, to help you to really discover, you know, the sign and symptom. Because once we know something is, it's because we can think about, you know, let's say that we can feel something and then we don't really pay attention. But if we have any sign and symptom and we pay attention and we ask and we seek and we go and seek for help, believe it or not, um, there is damage we can we will be prevented, that can be prevented. So that's why it's so important. That's why my role will be mainly that. My role will, I just want to give you guys tools to recognize what is wrong. Okay, it's not normal when we see those kind of symptoms, either uh, with you, who either you who has the sign of symptom or your loved one or your friend, so you can, you know, you can have that knowledge. We said no, that's not normal, you need to seek help before it's too late. So and also the providers of choice for the disorders of mind and emotions, you can talk to your primary care providers. And again, your primary care providers can be an MD, a doctor in osteopathy, can be a nurse practitioner, and can be a physician assistant. So, and those providers can lead you, can help you, can guide you really. Uh, what is the next step? And psychologists, they are very good. You know, they are really attentive. They you know their their role is to listen, is to go deep into the emotion, into your mind, to see what's wrong, why you feel this way, what can they do, what kind of therapy they can give you, what kind of coping skill you can have, because most of those disorders, it's, you know, you will need to have a coping skill to deal with them. Okay, let's say stress, right? Let somebody have a lot of stress, so you need to recognize what caused the stress. And remember, again, remember the inspirational thoughts in the beginning. What I said, the inspirational thought was what? Don't be afraid to walk away from things, places, and people that leave your soul or your heart heavy or broken. So, yeah, so you have stress. Okay, if a situation give you those stress, you know, if you have, you know, if you recognize that situation, that's why you have the stress. And you know what stress can do? Stress can lead to almost anything. So you, this is your responsibilities to remove you from that uh, situation. Even though if you have to start your life all over again, believe it or not, take it from me, it's worth it. It's worth it to start all over again, just to have your peace of mind, just to be at peace with yourself. Because when you're at peace with yourself, you feel that you feel, if you that feeling, you can even explain it. Okay, your heart, your chest is not heavy. Okay, your heart is not beating so fast, and you have more strength, you have more energy to do more stuff, to help other people. But if you stay in the situation who is very stressful, first of all, that situation going to lead to diseases. Okay, can lead to high blood pressure, can lead to acid reflux, which is good, can lead to GI issues, ulcers, can lead to cancer. So why remain to a situation where you have so much stress? So that's why um, psychologists come in. They will help you with coping skill. To you and the psychologist will develop. They will help you to develop some coping skills so you can deal with those situations. Therefore, you won't be able. Therefore, you will be able to live the life that God intended you to live. Um, so on that, I wish you best of health, and just what just remember. Okay, try to live a life, your simple life. Try to remove most of the stress. By the way, some stress in your life is good. Okay, there is good stress, there's bad stress. So I'm talking about situation, the bad stress. Let's say good stress. Okay, somebody said, okay, what she's talking about? What a good stress? Yes, when somebody having children, it's very stressful, but it's a good stress. When you see your baby, you feel happy because you are. It's a good stress. The end result is good. Let's say somebody, they have, they meet somebody, they got engaged, they get married. This is a good stress for that person. What is a bad stress? A bad stress can be a divorce. A bad stress can be you lose your job. Okay, bad stress can be that you fighting with someone, with your loved one. Okay, all those stress. All when I'm talking about stress, I'm talking about the bad stress, not the good stress. Good stress is good for you. Bad stress. So on that, I wish that that topic, that educational topic, will help you. Even though it's not for you, it's for your loved one. That will help you. Okay, so on that, I wish you the best of health. Until next time. To Today in the evening, I'm going to come up with another topic. Um, and just remember to subscribe. Remember when you subscribe to all. So whenever I am live, you can be notified. And also, please like and share, so more people will know my channel. So whoever who is interesting, about with their health, they can have, some knowledge. And as everybody knows, knowledge is power. And you need to be the captain of your own health. Okay, you need to um, know your body. Therefore, when something goes wrong, you know exactly what's going wrong. And by having knowledge about sign and symptom, this is one another way we know, oh, something is wrong. I need to seek for help. So I wish you best of health. Until next time. Bye bye.